Today's lecture deals with digestive system infections. So our digestive system includes our GI tract and some accessory organs like your tonsils, appendix, Peyer's patches, etc. And this little picture over here just shows you where all of those parts are arranged in our body. So there's a lot of barriers that limit microbes from getting in and colonizing in our GI tract. A big one, lysozyme in your saliva. Your stomach is acidic. There's bile salts that will kill bacteria. And also we have some immune cells and lymphatic tissue that we call mucosa-associated lymphoid tissue, or MALT, that also protects us very well. Now, there's a lot of different organisms that are normal parts of our biome. For instance, in the gums, we have the genus Neisseria, Haemophilus streptococcus. Your mouth has strep in there as well as some other microbes. Now, in our teeth, these particular microbes can grow as well. Our stomach may or may not be colonized with Helicobacter pylori. And our small and large intestines, again, have a very wide variety of different microbes that can grow there. Now, the main term from this slide I'd like you guys to know is dysentery, and that's diarrhea accompanied by pain, blood, and or mucus. So diagnosis of GI tract infections can occur by a bunch of different ways. First of all, you have to get your fecal samples, culture them by selective and differential media, molecular analysis. There's a lot of PCR methods now that are actually out there. And for things like parasites, worms, etc., microscopic examination is done as well. Now, one infection that you guys may have never seen is mumps. And mumps is a viral infection of the salivary glands. And if you take a look on the side of this child's face, it's very, very swollen. Now, mumps can be one-sided or on both sides. Again, guys, this is something that we don't see as much anymore because of the MMR vaccination. A lot of you brought that up speaking about measles because it's measles, mumps, and rubella. But mumps is something, too, that we don't see that often anymore due to that vaccination. Now, rotavirus is an acute viral type or can cause an acute type of gastroenteritis, and it's an RNA virus. And this is actually in kids one of the leading causes then of enteritis. Now, norovirus is the leading cause of acute viral gastroenteritis in the United States. And greater than 50% of all the outbreaks seem to occur in long-term facilities. So nursing homes are pretty hard hit with this particular virus. Now, hepatitis, first of all, it actually means inflammation of the liver, and it can be caused by infectious and non-infectious sources. Now, the three primary causes of infectious hepatitis are hepatitis A, B, and C. Now, one of the things that you guys should notice here is that the family names for these are different. So anytime that you see a disease where we have letters, such as A, B, or C, it means they all cause the same disease, in this case hepatitis, but they're not the exact same virus. So they're in different families. Now, when we talk about things like HIV or herpes, those are numbered, which means that they are definitely related. So for instance, herpes 1, 2, 3, 4, etc. Those are related. Now, in regards to hepatitis A, a key thing you guys should know for your test is that these can cause foodborne and waterborne hepatitis. Cases in the Bay Area have gone up before all this COVID stuff started. It was starting to show up in a lot of restaurants in the Bay Area. And it can remain infectious for months outside of the body. So that's something that we have to keep in mind. Now, hepatitis B, that's been around for a long, long time, guys. It's also highly infectious. Vaccination started in 1991, and that reduced the infections by about 82%. Now, something interesting is that chronic types of hepatitis affects up to 2.2 million people in the U.S. Now, how do you get it? Well, direct contact, body fluids, sexual contact, needles, razors, toothbrushes, accidentally poking yourself with something. Actually, the baby can get it during childbirth, etc. But there's no evidence that there's transmission through breast milk. Complications, please know one of the complications, guys, is cirrhosis. If you take a look here at this beautiful healthy liver, nice and reddish brown, but look at all of those deposits that are inside. The liver itself actually gets hard and enlarged. Hepatitis C. Interesting to note, guys, that there's about 3.2 million people infected with HCV in the United States. That number is probably low because a lot of people don't get diagnosed until later stages. This one, 60% of cases have been shown to be due to injecting drugs. So drug use is number one. Sexual comes next, sexual activity, transfusion. We don't know about the others here, how they occur. So basically, early infections are asymptomatic. After a while, a lot of different kinds of different liver problems start. 70 to 85% of patients develop a chronic form of the infection. And again, guys, please know for HCV, liver cancer and cirrhosis are what's normally seen. Now, hepatitis D, the main thing I'd like you guys to be aware of is you can only get hepatitis D if you already had hepatitis B. Now, this is very rare in the U.S. However, in other parts of the world, we do see a lot more of hepatitis D. And the last type of hepatitis, guys, hepatitis E, is rare in the U.S., but again, in other parts of the world, it is a concern. It infects about 20 million people per year, so that's pretty high. So, and about 56,000 people can die due to complications with hepatitis E. Now, another thing we need to be aware of, guys, is good oral care, oral hygiene. And it's not just cavities, guys, but periodontal disease. So 67% of adolescents have had some kind of cavities. 70% of people over 65 have some type of periodontal disease. Now, periodontal disease is the leading cause of tooth loss in adults. So with periodontal disease, guys, it starts with what's known as gingivitis. Gingivitis, that's inflammation of the gum. Now, if you don't get the gingivitis under control, it leads to periodontitis. And basically what happens there, you keep getting inflamed gums, erosion of the bone surrounding the tooth, pockets form, and it can be very painful, and your teeth can fall out. Now, as far as dental caries go, plaque will promote tooth decay. And the main one for your exam to know, guys, is Streptococcus mutans. Now, this particular one can metabolize sugar. And again, if it metabolizes the sugar, it can create acids. And that's what actually starts to erode your teeth and cause dental caries to occur. Now back to periodontal gum disease. I just wanted to show you a picture. This is pretty severe, guys. But if you look, the gums are swollen. You've got this tartar, that yellowish stuff, and the gums are definitely receding, and there's pockets there. Now, class, this isn't blood that you see here. This is actually a stain that's showing where the tartar gets built up on your teeth. A leading cause of ulcers in some people is bacteria called Helicobacter pylori. So please know Helicobacter pylori, guys, can cause stomach ulcers. And it's estimated that about 66% of the world's population is infected with this microbe. So what happens, guys, is the Helicobacter pylori will infect the mucosal lining of the stomach, and it starts to colonize. Then that causes inflammation, guys, and then you get tissue damage and the stomach lining starts to erode. Now, as that epithelial layer erodes, we get the stomach acid that's starting to hit the cells down here, and eventually, as you can see over here, you've got an ulcer that formed as a result.